Continuing with more news, we're going to look at some health matters. Mpox epidemic accelerates in the Democratic Republic of Congo. Doctors Without Borders is concerned about the possibility of a major spread of the disease due to huge population movements in and out of the country. More than 12,300 cases have been recorded in the DRC from January to mid-July 2024. Close to 500 people have also died. Mpox is an infectious disease that's caused by monkeypox virus. Although the DRC has validated 2 vaccinations and is working to get supplies, no vaccine is currently available to curb the spread of this virus. And so for more on this, we're going to now be joined by Marietta Nagtzaam, Doctors Without Borders South-Kivu's head of mission. A very good morning to you, Marietta. Thank you for your time on the SABC at this hour.
Thank you. Good morning to you.
The facts, the data, the figures coming through at this hour in relation to what's transpiring. Perhaps you could tell us a little bit more about the latest results, the response at large as well.
Well, I think you already mentioned the latest results, which are quite recent. So, yeah, it's really worrying. So the surge of cases is actually starting in 2022, but then notably in the first half of 2024, we saw a more worrying situation where a mutation has led to more human-to-human transmission in South Kivu, which has actually now caused a lot of additional cases. Another worrying aspect is the fact that in North Kivu, so the province north of where I'm based in South Kivu, where there's a lot of IDPs, over 600,000, the first cases have been reported there as well.
And so thank you for painting that grim picture, because at this point, given the vulnerabilities as well, and due to the numbers that seem to be escalating, what are the typical challenges that medical staff are incurring at this point, given the resources, given accessibility as well?
Yeah, those are a few very interesting things. Well, for starters, because the mutation is new, the population doesn't really recognize the disease as such. Well, I'm not a doctor, but some of the symptoms, notably if it's with children, then it could be easily confused with, for example, measles, because it also has the spots all over the body, or could have the spots, the lesions all over the body. Another aspect is that because it's human-to-human transmission, there is very strong rumors that it's only sexual transmission, which is not the case, which created a lot of stigma and even fear to come and search for healthcare. So unknown combined with stigma made it very difficult. And then an aspect which is very, I would say, regular in the context of the Congo is that the health system is a bit weak. And there's no possibility to get healthcare free of charge, and people just don't have the means to pay for it, for the medication and the treatment. So what they usually do, they will most likely delay their search for healthcare, or would even go to traditional healers, which could actually aggravate the situation until they actually arrive. So putting that all together makes it very difficult. And then there's the vast country and the road access that's very, very difficult for people to actually move around simply. So that's a very challenging aspect. Another aspect that's very challenging is actually the confirmation of cases. Getting the sampling done at suspect cases and then transporting the materials to Bukavu, which is the capital of South Kivu, where we have the lab to test those cases. That is unfortunately delayed a lot, and a lot of invalid results are coming up, which hampers a little bit the visibility of the progress of the disease itself. So those are a few things that are really difficult to handle all this.
And so as the country aims to mitigate against these challenges that obviously have posed a national health threat at large, you're speaking about sifting through myths and the spreading of the virus, given the mutation and even some of the symptoms incurred, how education is really vital. The issue of vaccines also coming to the fore to curb it, the measures that are being used, What's also unfolding on that front? What treatments are available? And in terms of surrounding countries, travel restrictions and those matters, is it inevitable that restrictions need to be looked at on that front?
Well, you mentioned a few very interesting aspects. For starters, the education of the population is very, very important, and that's one of our pillars of our intervention that we do in South-Kivu. Is we call that community engagement, and we organize a lot of focus groups to make sure that in the community it's well understood what the disease is, how it spreads, and that they can find free healthcare that we offer in support of the Ministry of Health in the hospital, in this case, in our case, in Uvira. So that's very critical, because without that sensitization and that community engagement, people wouldn't know. So we use radios, megaphones and all that, and a lot of focus groups. Then the other particular part of it is, yes, we are at a border front. Basically, it's a bit the area where we border Rwanda, close to Uganda, Burundi, and then the eastern part of the DRC. So cases have already been reported in Uganda, Rwanda, and Burundi, if not other countries around us. But I'm now focusing on the countries bordering our province. So that's a very tricky part. Okay. On vaccines, there are some developments, but they're a little bit slow, because I think we will lose some time, or we will need some time, let's rephrase it, to get negotiations done. And
I'm going to have to just interject there. Let's leave that conversation there for now. Thank you for your time and for weighing in. We'll monitor those developments as we continue to see the numbers increase there. Monitoring a developing story now.